Hey everyone! So my condition that I picked for this semester for the genetics class is primary congenital hypothyroidism. And I was initially interested in this condition because I do have a sibling that has hypothyroidism. It wasn't congenital hypothyroidism. But that kind of sparked my interest in this condition, which is why I picked it out of all of the other ones that we had. Okay, so a little bit of history on the condition. So it is an endocrine disorder that is caused by an underactive or absent thyroid gland. And your thyroid gland is what synthesizes and secretes thyroid hormones, which are super, super important and are responsible for things like early growth, brain development, and metabolism. And then right there on the right, you can see the picture of your thyroid gland, which is located right in your throat. And yeah, it secretes thyroid hormone. So there are two types of hypothyroidism. One of them is called thyroid dysgenesis, and that is when the thyroid gland is reduced, absent, or abnormally located. So pretty much something is going on with the thyroid gland. It's either not there, it's located somewhere else, maybe part of it is missing. And that's most of the cases of congenital hypothyroidism. It's 80 to 85% of the cases. So the other less common type of congenital hypothyroidism is thyroid dysmonogenesis. That's tricky to say. But in those cases, those are 15 to 20% of the cases, and that's when the thyroid gland is there, but it's just not able to synthesize the thyroid hormones appropriately. So there's some sort of mutation going on where the thyroid gland just isn't producing the hormones that it needs to produce. So that's a little bit of history. So symptomatology of congenital hypothyroidism. Actually, a lot of newborns that are born with CH don't show any signs at all, which is why newborn screening is really, really important to make an appropriate diagnosis. But all newborns in the US are tested for CH, and they're tested 24 to 48 hours after birth. Some of the signs, as you can see the little baby on the left, some of the signs include a puffy face, kind of a large swollen tongue, some soft spots in the skull, which I mean, all newborns will have soft spots in the skull, so that's a little vague. A hoarse cry, an umbilical hernia, some feeding issues, constipation, hypotonia, or jaundice. So as you can see, I mean, a lot of these signs and symptoms are ones that a lot of newborns are born with or have. A lot of newborns have soft spots in the skull. They might have feeding issues. They might have constipation or jaundice. So it's a little bit tricky. But if left untreated, it can cause cognitive deficits. So super, super important to treat CH really early on. So the prevalence of CH, it is the most common congenital endocrine disorder. And by congenital, that means that it's something that you're born with. So you have it since birth, and it's the most common endocrine disorder that people are born with. It affects 1 in 2,000 to 4,000 infants. So that's pretty common. And it affects twice as many females as males. And I wasn't really able to find out why that was. I kind of did some research, but there was nothing that I can find as to why it affects more females than males. It is increasing throughout the world, so more people are being diagnosed with CH across the world. And I read a couple of things that said this might be due to maybe just ethnic differences throughout the world, environmental factors, But I think the one that makes most sense to me is that there's just improved newborn screening practices. So more countries around the world are mandating screening for CH in hospitals. So if there's more screening being done across the world, more babies are being diagnosed with it. Okay, so just talking a little bit about newborn screening. So like I mentioned, there's mandatory testing in all 50 states in the US, and many other countries are mandating it as well now. Most newborns are tested 2 to 4 days after birth, and this is super important to do because if you test a newborn before that time frame or after that time frame, their thyroid hormone levels might be a little bit off. They might be elevated falsely. So you want to do it within that time frame. And early detection is super, super important. Otherwise, the child might develop some neurologic, motor, or growth delays. The molecular causes of CH. So most CH is actually caused by a lack of iodine in utero, which is why it's super important for a lot of women to take supplements with iodine while they're pregnant. So genetic causes do account for 15 to 20% of CH. So like I mentioned, thyroid dysgenesis, when the thyroid gland is absent or reduced, CH is caused by a mutation in the PAX8 gene, or the TSHR gene, or the DOX2 gene on various types of chromosomes. And all of those genes right there are involved in the development of the thyroid gland, which is why it makes sense that if there's a mutation in any of those genes, then the thyroid gland might be absent or missing a chunk of it, or it might be located somewhere else. So when thyroid hormone synthesis is impaired, then CH is caused by mutation in the DOX2 gene, the SLC5A5 gene, and TPO gene. And this also makes sense. Those genes are involved in the synthesis of thyroid hormone. So if there's a mutation in those genes, then thyroid hormone isn't being produced appropriately. Okay. Mode of inheritance. So most cases of CH are not inherited, but inheritance occurs in 2 to 5% of cases. And it does carry an autosomal recessive inheritance pattern, which means that both of the parents either have to be affected with the disorder or they have to be carriers of the disorder. So a child will get a mutated gene from the mother and a mutated gene from the father that they pass down to the child. And here's just a little simple pedigree of the inheritance pattern. So as you can see in the first block, the number 1 block, it looks like the female must have been a carrier for the disorder and the male was afflicted with CH. And so they both had the gene for it and they passed it down to their children, and one of their children, number 2, was afflicted with the disorder. So that's how that works. So genetic testing for CH, there are 18 available tests that detect CH. There was one biochemical test that measures proteins in DNA, but all of the rest of them are molecular genetics tests that analyze sequence of genes to detect CH. And the typical cost of these are about $1,500 to $2,500, so they're pretty expensive. There's various companies that offer genetic testing. I saw a lot of universities, like their genetics departments, will offer the testing if you send in your lab work. So like the University of Chicago Genetics Lab will do it. And there's also a lot of independent genetics companies that will also test for CH. One of them was Blueprint Genetics. Treatment. So after diagnosis is confirmed, treatment begins immediately, which is why it's super important to be diagnosed early on if you do have CH. And thyroid replacement therapy is done right away. The medication that is used is called L-thyroxine. And right here is the molecular structure of L-thyroxine. And usually once treatment has began, thyroid hormone levels go back to normal by 3 weeks of age. So works pretty quick. And prognosis of CH. So this depends on the severity of the hypothyroidism when the baby was diagnosed. So again, the sooner the treatment starts, the better the prognosis. In newborns that were treated before 3 months of age, the mean IQ was 89. So average, pretty much. But the mean IQ drops significantly to 54 if treated after 6 months of age. And 54 that would be considered a cognitively deficiency. It's below 70. So that drops pretty down. There is also monthly monitoring of thyroid hormone for the first 6 months of life, and then daily use of the L-thyroxine, which is the thyroid treatment. And then again, if left untreated, it can lead to intellectual disability and slow growth, since the thyroid hormone is responsible for brain development and just overall growth and metabolism. So it can be treated. The prognosis can be really good, just as long as it's diagnosed early on. And then for my last slide are just all of my references that I have. Well, hope you enjoyed the presentation. Hope you learned a little bit about congenital hypothyroidism. Have a good rest of your day. Bye-bye.